A nonstress test is scheduled for a client at 34 weeks gestation who developed hypertension, periorbital edema, and proteinuria. Which of the following nursing actions should be included in the care plan in order to best prepare the client for the diagnostic test? Number 1. Start an intravenous line for an oxytocin infusion. 2. Obtain a signed consent prior to the procedure. 3. Instruct the client to push a button when she feels fetal movement. 4. Attach a spiral electrode to the fetal head. Let's go over this question together. Step 1. Read the question carefully. Look for keywords such as best. Step 2. Reword the question in your own words. Step 3. Understand what it is asking. It is asking which of the following nursing actions should be included in the care plan in order to best prepare the client for the diagnostic test. This means that all the answers are possible, but what is the best, most helpful for this specific patient? The patient has hypertension, periorbital edema, and proteinuria. Step 4. Read each answer carefully. Step 5. Eliminate at least 2 wrong answers. Number 1 is incorrect because this would not be used in this circumstance. Number 2 is also incorrect because the situation doesn't suggest an immediate need for the procedure. Step 6. Reread and compare your last 2 answers. Which answer is the best answer? Step 7. Make a decision. Now let's see if you got the answer correct. The correct answer is 3. Instruct the client to push a button when she feels fetal movement. The well-being of the baby is a priority, and because the mother is a high risk, there is a chance of the baby needing further help. Before any type of intervention, nurses must first assess the patient. If you want to practice more test-taking strategies for your NCLEX exam, then click on the link below in the description. You'll land on a page where you can enter your details to get instant access to a free online test bank. Consistently practicing test-taking techniques is one of the best ways to pass the NCLEX on your first try. It's time to become a registered nurse. Click on the link below now.